Robert von Jungs and Frank Mensink and Mike Gibson coming to you live from ESC 2024. And we're talking about aggressive lipid lowering with PCSK9 inhibition after ACS and the function over in the uninvolved artery, the non-culprit artery. Talk to us about what you did and what you found.
Yeah, so let me introduce Frans, who's to the right side of me. He has been doing the majority of the study work. Our aim was to get some more insights in the multivessel disease patients with ACS. So we have a lot of different studies, do early interventions, do stage procedures, etc. And we have, on the other hand, some studies saying on non-significant bystander lesions that if you look at Pacman and Huygens, that you can improve the quality of these lesions, so make them more stable. And then we wanted to see if we have some lesions where you consider to doing an additional PCI, if we would do first a 3-month period with PCSK9 on top of statins to see at the stage procedure if these lesions were more stable and less hemodynamic relevant. So that was the concept. I said to Frans, and I said, Frans, give me the details of this trial design, and he was working on that for the last 3 years.
Yeah, so I've been working on that project as part of my PhD thesis also. And what we did 3 years ago, we designed this study, and we wanted to include 150 patients with ACS and multivessel disease, which received PCI of the culprit vessel and culprit lesion, and then they had to have a significant non-culprit lesion in a non-culprit artery, which during the intervention we measured with FFR. And if FFR was between certain thresholds at 0.67 and 0.85, patients could be included in the study. And then we randomized them to either placebo therapy or PCSK9 therapy, which we continued for the next 12 weeks, so 3 months. And after these 3 months, we again called these patients back to the cath lab and did repeat FFR measurements and also repeat IVUS measurements to check if there was any change in the non-culprit FFR and non-culprit IVUS. So these were our endpoints.
And what did you find?
Well, we found that in the end, after 12 weeks of therapy with PCSK9 inhibitors and HIST as a background therapy, with placebo as the comparator, there was actually regretfully no change between FFR between the groups. So between evolocumab and between placebo, there was no change in FFR. We did see an overall change in lipid content. So for the whole group from baseline to follow-up, there was a drop in max LCBI 4 millimeters and also total LCBI. But again, if you compare with placebo to evolocumab, there was also no change in lipid level between the two groups, regretfully, but there was a whole group change.
So no real improvement in the percent stenosis and the hemodynamics. I mean, in 1987, that's how I started my career in the Harvard Atherosclerosis Reversibility Project. Years lowering lipids, a 1% improvement in stenosis. Doesn't really change the percent narrowing that much or the structural part, but it does change perhaps some of the constituents of the plaque. And I know it didn't achieve significance, but it's going in the direction we might have anticipated. I know you spent several years on this. I know how much work it is. Every piece of information always adds to what we know. So congratulations on a very carefully done study. I appreciate it.
Thank you very much for the compliment.
Yeah, I think it's still relevant information because this is a study which was done in 12 weeks, and with all the work you have been doing, you see with statins and reducing your LDL to 70 milligrams per deciliter, already in 12 weeks, we see a difference in plaque composition. And we know ACS patients have a high risk either on the non-culprit lesion itself or other lesions in it, in these coronary arteries. And for the first time, we have seen that you can see a change in plaque components in 12 weeks. So that's a major observation. While Huygens and Pacman all were at least 12, and Glakov was even longer, 18 months before you did see any change.
So yeah, that's a very important point. This is on top of standard LDL lowering. I mean, you know, I'm on a Torva and a PCSK9 inhibitor. I don't think you can be too rich, too thin, or have too low of an LDL, you know, so 70 may not be enough. Getting down below 55 may be important. So
yeah, we hypothesized on this and say, is this just an effect? Because quite some of the patients were statin naive. So we now have the impression that in the first 12 weeks, this kind of lipid lowering in the vessel wall is being reduced at the same speed. But if you continue longer on such low LDL levels, then you will have a more significant effect, might have more significant effect if you are adding PCSK9. So you drop lower in your LCBIs at 12 months, what we have seen in Pacman.
Yeah, and also in line with previous studies, in our study, the PCSK9 group, LDL levels were in the PCSK9 group dropping really low just after a few weeks after treatment. So I think if you continue that treatment longer, like other studies, maybe we would have seen more effect.
Yeah, longer may be better, earlier may be better. The concept of cholesterol years, it's the area under the curve of the LDL over a long period of time that's really important. Well, thanks for presenting this, and thanks to all of you for joining us here live from ESC 2024.
Thank you for having us. Thank you.
Thank you.
Okay.